Good morning, good afternoon, depending on where you are. My name is Professor Simon Gilbody, and I'm based at the University of York, and it is my great pleasure to welcome you to this webinar where we, over the next hour or two, seek to explore the psychological impacts of COVID. So sending good wishes from the United Kingdom, and I am joined by three esteemed colleagues. My colleague, Dr. Najma Siddiqui from the University of York, my colleague, Professor Pratima Murthy, Professor of Psychiatry and Addictions from NIMHANS in Bangalore, and Professor Azad Nizami from Rawalpindi Institute of Psychiatry, where he is Professor of Psychiatry. So we have three excellent presentations today, and at the end of our session we have some space for some questions, and this is an interactive webinar and you have the facility to ask us questions, ask the presenters questions using the chat function of the webinar software that we are using. So please contribute to the conversation. Please keep the conversation relevant. If there's something that you'd like us to address at the end of the presentations that you feel is important, or if you wish to make a comment, then please do so with the chat function. So the first of our presentations this morning is from my colleague, Dr. Najma Siddiqui. So over to Dr. Siddiqui.
Thanks, Simon. I'm just going to put some slides up. Okay, so thanks for that introduction. Wishing you right at the start Ramadan Mubarak, and hoping that we'll keep it a physical, though not a social distance throughout Ramadan. So in this webinar, as Simon said, we're going to be covering the mental health consequences of the pandemic for the general population. There's lots of information coming out, both from this pandemic, but also looking back at previous outbreaks and natural disasters, that the mental health of actually healthcare workers and other frontline staff is often differently and more profoundly affected. And there are lots of other groups as well, vulnerable groups such as people with mental disorders. But today, because of the limited time, we are going to focus just on giving an overview of what we might expect for the population at large, more generally. So I'm going to start by talking about what you might expect, what you might call part of a normal response. And then I'm going to mention the sorts of things that might alert you, that might indicate that someone needs to seek additional help. And finally, I'll present findings, some emerging data from China about what we're seeing. And then my colleagues, Professor Pratima and Azad, they're going to go on to the most useful part of this, which is what can you do to help yourself, and what can you do to support others, and what are the other sources of information and support that are out there. And then, as Simon said, we'll end with a question and answer session. So it's almost inevitable that a pandemic like this is going to affect people's mental health. And first off, I think it's just very important to acknowledge this fact. Recognizing it means that we can be better prepared to help ourselves and others to cope, and we can prevent things from escalating, and we can get additional help where needed. There are lots of reasons that people's mental health might be affected just now following the outbreak, and some of those are more obvious than others. So we know that there'll be lots of anxiety about the risk of getting the infection, loved ones getting it, and all that means. But then there's also the impact of the measures that have been taken to prevent the spread of the epidemic, the quarantine and lockdown measures, the physical distancing, etc. And that's been affecting almost all aspects of life. So people are grappling with lockdown, social isolation, in cases access to food, healthcare, education, jobs, problems with finances, and stigma. And that's not to mention, of course, bereavement, the loss of loved ones, and guilt because of the restrictions limiting what people can do at the end of life. And then there's the news, the constant stream of reporting about what's, just lots of really worrying developments, and that's going on all day, every day. At the same time, we've got a disruption to our usual sources of support and the sort of outlets that we use, the activities we do, the people we might rely on to keep ourselves busy, preoccupied and strong. So how we react, of course, is going to vary person to person, but there are some things that are going to be fairly universal. Human beings tend to experience any change, and particularly change that's accompanied with a lot of uncertainty, as challenging. Uncertainty is generally also experienced as threatening. We are not in control, and that feeling's not a good one. That feeling of loss of control. And if you add to that, in this pandemic, there is also a threat, the risk of infection, the risk to health, but also the threat to all the other things that I mentioned, things that we value, obviously food, livelihood, education, housing, social support. So all of these together, they're going to have a knock-on effect, because what we're experiencing is multiple threats from all different directions. So I'm sure you've heard of the flight response. I'm not going to go into that in any detail, but when we face a threat, the body reacts in a certain way, and that's in the face of a real or perceived danger. But what we're facing is not an acute danger, it's a chronic and ongoing threat. So it's going to be really common for people to feel worried and stressed and fearful and anxious and tired. So a bit more about what's going on both in our minds and bodies. So we know that at times of great worry and anxiety, we often get recurrent negative thoughts. What's going to happen? How will it affect me? Even, here, will I die? So that leads to negative emotions, feeling apprehensive, anxious, sad. And these are experienced as really very unpleasant feelings. They're quite hard to tolerate. And alongside this, we often experience physical symptoms, things like things that are common are feeling breathless, tired, lightheaded or faint, feeling shaky and sweaty. And you can see that some of these symptoms might be particularly scary if you're having them during this pandemic, as they might overlap with the symptoms of the infection, and that's going to drive even more worry. We know that all of these things can lead to a vicious cycle, as you can see on that slide, with behaviours such as withdrawing and stopping doing the things that you usually enjoy doing, and also problems with sleep, which in turn makes people more low in energy, tired and irritable. And at the same time, people are going to be cut off from the outlets they might usually use to make themselves feel better, and may turn to more harmful behaviours such as alcohol and smoking. So one thing I haven't mentioned so far is that irritability can develop into frustration and even anger. And actually anger is really common, we're seeing that as a reaction under isolation and quarantine. Again, just to re-emphasize, it's really important to recognize that if you're experiencing some stress, anxiety, fear, sadness, and even anger, this is normal. This is what you might expect. And you may also be having trouble sleeping. Again, this is common. And that doesn't mean that you should just ignore it. And it's not dismissing or minimizing all of these things by calling them normal. And my colleagues are going to later on go and talk about the sorts of things you can do to help. But it's often just reassuring and helpful people to know that other people are also experiencing these things as well. And it's not necessarily a sign of illness. So what are the signs that things might be escalating, that you might need to get help? The key things are when things are persistent and severe. So these things are happening to a much more severe level and continuous. So the thoughts and the worries are taking over. They're taking over your days, your life. You can't focus or concentrate. They're impairing everyday function. So a few days of disrupted sleep spills over to becoming several days in a row, and you just can't get back to your normal routine. You end up feeling overly tired. That drops your mood even further, and then your worries are overwhelming you. You feel paralyzed by them. Your mood is low and it stays low. It's not responsive. You get persistent negative thoughts and feelings of hopelessness or worthlessness. These are all key signs to get additional help. And as I said, we'll cover where to get that help from later in the webinar. So just a bit of evidence that's coming out. There's been a recent literature review looking at the psychological impact of quarantine. So this is separate from a pandemic, just looking at the impact of quarantine. And it only found a handful of studies in the general population, but reported overall a very high prevalence of symptoms. So the general psychological symptoms, some studies also reported emotional disturbance, low mood, depression, irritability, insomnia, symptoms of post-traumatic stress, anger, emotional exhaustion, guilt was in there. And low mood and irritability really stand out as having a very high prevalence at 73% and 57% respectively. It's worth noting that inadequate information seemed to be quite a key determinant of some of these symptoms. So people who know what's going on and are informed seem to do better. But that has to be balanced with people who just get addicted to, incessant news. So finally, another recent publication. This is from, this is an online survey from the Hubei province, say recently published. They did a survey of the general population and used measures of well-being and depression, anxiety, and they also used the audit questionnaire to look at alcohol problems. And they showed very high levels of mental distress and also disorder. So about a third had poor mental well-being, and levels of depression were quite high at 37% overall. With just under 30% having an anxiety disorder, and really quite worrying levels of alcohol problems at 40%. So there's evidence of significant psychological impact, which is what we'd expect. But of course, we'll need studies also to see what's happening in the UK and in South Asia, because obviously, some of these findings may not translate. So I'm going to stop there. Thank you for listening, and I'm going to hand over to Professor Pratima Murthy, and if I can work out how to do that. So sorry, Pratima, I think you're muted.
Afternoon. Hi, can you hear me now? Yeah. Thank you very much, Simon, and thank you, Najma, for kind of introducing this topic. I'm just going to get my screen, my slides up. Hi, everyone. So I'm going to be talking to you in the next few minutes on COVID-19, me and my mind. I think we've never really experienced something so close to us. Any infection or any disorder is something that we have felt is kind of outside us. But I think COVID-19 has brought every possible disease almost, made it very, very proximal to each one of us. And I don't think there's anybody who's not impacted by this situation. All of us in different parts of the world are in different phases of the pandemic. In Bangalore, where I am, we're entering the community phase of it. But a lot of the fear that we experienced was probably much before it became a problem where we were. So it's not really being in an imminent situation of COVID infections in and around you, but really the fear, which is the first part of it. And this fear can be a variety of things. I mean, it can be whether I might catch a COVID infection or my family members would. It might be about, whether I should go to work or whether I'll catch something at work. It might be a variety of things depending upon the phase of the pandemic. The second thing, of course, is worry. The worry might be about health, might be about catching the infection. It might just be worry about a whole lot of other things, including people around me, including work, including finances, and so on. Najma mentioned uncertainty, and I think with any other infection, you know how long it's going to last, you know generally what the outcome is. Here, the uncertainty is both in terms of your risk to infection as the longer term consequences of something like this. We don't know when lockdown is going to end. We don't know when work is going to resume. We don't know how long physical distancing it needs to be kept. So there's a whole lot of uncertainty for a variety of people. And that's another cause for making the situation so dramatically different from other situations we faced. The last thing is, of course, insecurity. There's a sense of personal insecurity, there's a sense of collective insecurity, and there's a sense of national insecurity, and perhaps a sense of global insecurity, because we don't know where all this is headed. So the fears we can talk about are getting sick. Najma mentioned this. I mean, especially during flu-like times, any sore throat, any feeling of flu, one thinks it's COVID infection. I've experienced this myself, and I'm sure many of you have, that, in the morning when you get up feeling a little stuffy, the first thing that comes to your mind is, oh my gosh, what could this be? Should I isolate myself? Should I get tested? And this is the fear. And this kind of fear obviously amplifies in a person. Let's say if you are in contact with somebody who's COVID positive, or, you've spent time with somebody who's been COVID positive. And of course, indeed, if there is a situation where you might actually have COVID infection. The next and most worrisome fear, particularly for people who live with families, is, they've heard about the illness, they know in a majority of the people it may not be very problematic, but they're very worried about the elderly family members to whom they might spread it to, or indeed young children and people who are at high risk. And that becomes an extremely difficult thing for people to manage, fear as well as guilt about what might happen to people around us. So in some ways, that's very altruistic, but that can also become extremely troublesome. How does one conquer this fear? Najma mentioned this. The most important thing is the right amount of information in the right dose. I know when this COVID epidemic started, we were all glued to TVs. We knew the numbers. We knew exactly how many people in China were infected, how many people in Italy, in England, in the United States. And then, of course, I did too in India. But then it kind of got extremely suffocating, because all you were doing is really, having these thoughts going round and round in your mind. So while it's important to feel fearful, to feel stressed, to feel confused, and even maybe to feel angry during such crises, it's very important to make sure that you're well informed, that you only turn to the right kind of sources. My friends like to say, please don't consult the WhatsApp university. Again, in social media, there are a lot of things that keep going around, a lot of conjectures, a lot of apparently scientific information. One must be very careful not to get overwhelmed by such information and only trust a few sources. And the second and most important thing is not to continually watch news channels flashing updates about the COVID epidemic and so on, or indeed follow social media, which is only focused on the pandemic. The other thing is really talking about these fears. I think it's very important to talk about fears. And not just to talk about fears, but on planning so that you can overcome your fears. You can talk to family, you can talk to friends, you can reach out to maybe workplace peers so that you can discuss your fears. And once fears are shared, a lot of the ventilation helps you to reduce some of these emotions. We talked about concerns and uncertainties, and and I think lockdown is possibly one of the most difficult times, because one doesn't know how long this is going to pan out, and one doesn't know what kind of adjustments one needs to make in the long run. So adjusting to a new reality for a certain amount of time is fine. I mean, you make these changes. Change is nice for a time, but when that change goes on and you don't know how uncertain, how long this change has to occur, then it can become very difficult. And of course, we all miss the hugs and the physical touches of young family members. If you have children, I think they miss the hugging the most. And since you can't connect with people you love the way you would like to, this can cause a lot of emotional difficulty. The third thing is, of course, a shortage of certain common supplies. I mean, one is hesitant to go out and get these supplies. And when you don't have enough stocks, you're worried about things going out. You will all recall the kind of hoarding there was for toilet paper, etc., in the early parts of the epidemic. And I think these kind of concerns about running out of supplies is yet another cause for uncertainty. But you must remember, it's your attitude that determines what your reactions can be. In the same situation, for example, lockdown, you can easily be well adjusted, learn how to pass your time, or you can be moping, lonely, and things. So I think there is a certain, even within the choicelessness, there is a certain choice to decide how you're going to deal with it. And if you're well prepared, it can be, it can be much less traumatic than if you're not. Insecurity, one of the biggest things that people are worried about is financial insecurity, loss of jobs, inability to return to the job that you were having, the concerns about family. And for people who have had the infection, of course, there is a lot of worry in the 5 or 10% of people who get really sick, and you don't know what the health outcomes are. This can be particularly times when you feel very insecure. Now, there is a lot of worry about, again, misinterpreting symptoms as also denial of symptoms, because one is so scared about actually having the infection. And that's a time when one must understand that 80 to 85% of people just have the infection and they get over it and they get back to it. So sometimes it's useful to look at the positive stories of how people recover. And as I said, you can choose either to panic or to plan in advance. And planning in advance can be from simple things like planning day-to-day necessities, planning your day schedule, even planning, I think with older people, even perhaps deciding that you will make a will because you don't know how to, what the outcomes will be, or even planning what you might do if you do become COVID positive and need to quarantine. These are all aspects of realistic planning which might actually reduce the anxiety around this particular illness. One must also remember that when we talk about wellness, it's important to get ourselves as resilient as possible by making sure we're in good physical health, our environment is as healthy as possible, our financial health is also something that we need to take care of, our job, our social relationships. This is a very important time to keep and mend social relationships and enrich social relationships. And of course, keep our emotions in check to be able to deal with the moodiness, with the anger, and with any other, severe emotional trauma that we may face. For a lot of people, being spiritual is a very good way to help to deal in this particular situation. So one of the things is to really get a good routine going every day, irrespective of whether you're going out to work or at home. Have a good routine, including waking up routines and sleeping routines. Be active during the day. Do both your necessary chores as well as do something that keeps your mind occupied. It might be gardening, it might be painting, it might be something like that. Have effective time management strategies. Use your resources. And now we have a lot of technology which allows us to have resources to be connected to others. Be accessible to family. Make sure you have people accessible to you. Sometimes you have to work from home, and that requires a lot of adjustment if you're not used to working at home. So make those arrangements. Make sure your room is well lit, it's well ventilated, so that you're comfortable working from your workspace at home. And make sure you reach out for support. What are the things that you can control? Your mind and body, it's very important to have a healthy diet, adequate exercise. We have pretty good guidelines about how much physical exercise you need. Even if you have to do it at home, you have to innovate how if you can't go out walking, maybe going up and down the steps is good exercise. Maybe exercising the various muscles of your body. Make sure you get enough sleep. Sleep hygiene is extremely important. And in these times when you're at home and there's no clear work-home balance, it's very easy to make your sleep habits erratic. Make sure you do the right kind of things and follow what are sensible sleep hygiene measures. Do not smoke or drink alcohol in excess. Take care of your mental health. How can you do it? Find some time to calm down, to calm your mind, to empty your mind of all the thoughts that keep going round and round in your mind. Maintain self-care, hand hygiene, personal hygiene. Make sure your workspaces are clean. Make responsible choices when you have to leave the house. Go only when it's necessary. Limit the person you come into contact with. And of course, be very careful with the dosing of the information you get from the media. Keep enough essentials at home so that you don't have to go out very often. If you have medications, make sure you have enough of a refill so that you're covered. And of course, in addition to the hand hygiene, physical distance is important. Remember, physical distancing is not social and emotional distancing. And of course, we all know that when we sneeze, whether it's COVID or not, we need to cover our noses and our mouths, and we frequently disinfect ourselves. What are the signs of anxiety? Najma already mentioned some of the signs of anxiety, but remember, you can have what are called autonomic signs, which is really the heart beating very fast, feeling very sweaty, feeling very tremulous, or there can be psychological symptoms like feeling a sense of impending doom, feeling that you're going to die, feeling that it's going to be difficult to take a breath, and so on. Remember, these anxiety symptoms tend to go away. One of the simple things that you could do is just breathing. And you might want to do it with me right now. Just sit down in a calm place, relax your body. To the count of 3, take a deep breath inward. 1, 2, and 3. Hold your breath. Feel a sense of warmth. Now gradually release it again to the count of 3. Completely relax. Let your entire body relax. Doing something like this 3 or 4 times is amazingly calming in any anxious situation, particularly when you have anxieties with relation to the COVID. Remember, the similar strategies can be used for anger. The simplest thing for anger is when you're feeling upset or irritated, just count backwards. You might do a slow count backwards from 5 to 1. And then you'll find yourself by the time you reach 1 that you've calmed down. The second thing to do to prevent anger is not to immediately react. If you react in the moment, your reaction is going to be definitely detrimental to you and the person you're showing the anger on. So make sure you wait a little bit, take a few deep breaths, and your anger automatically subsides. Similarly, if you feel low in mood, do behavioral activation. Get involved with something else, distract yourself, do something that you enjoy, maybe listen to music, maybe doing your favorite hobby or reading a book which makes you relax, and that can help you to improve your mood as well. If anxiety or any other things go out of hand, take a walk. It's amazingly good to have some degree of physical exercise to help you feel better. Also reach out to somebody and make sure that person helps you to calm yourself down. Meditation is a wonderful thing. There are lots of things you can get online nowadays, which treat you very simple ways of calming your mind. Of course, if the anxiety is very severe, there are helplines that are available. There are professionals who are available online. Make sure you reach out to them. If it's severe depression that is going on for more than a week, your mood, low mood, if you're feeling very anxious, if you're feeling agitated or suicidal, recognize this yourself and then reach out for help. You don't have to do everything by yourself. You can always reach out to people and get help. This is a wonderful time to reach out to elderly in your family to make sure that they're well. And altruism is also a very, very good way of feeling good. A lot of people talk about how they've been able to help others and make sure they get their provisions, maybe do a little bit of shopping online for them if it's possible. Making sure that others are well also helps you to feel better. So that's another good strategy to feel better. We've had a lot of, as a department, I work in the Department of Psychiatry at NIMHANS in Bangalore, and we've actually brought out a guidance to help people from the worried well to people who are, who have psychiatric problems. We've actually brought out this particular book, which takes you through a variety of things from, as I said, understanding the pandemic to really the common presentations to the worried well, to how to deal with anxiety and depression, because different people deal with it differently. Of course, if you're temperamentally a kind of person who's very sensitive, these can be difficult times. And therefore, it's very important to learn resilience and to get support. I'm going to leave you with these thoughts, and we can always come back for a discussion, and hand you over to Asad for his presentation. Thank you very much.
Okay. Thank you, Simon, Najma, Prathama. I'm very glad that I think the team organized this webinar, and I was told that about 90 people are engaged with it. So let me just start with my slide. Okay, so I hope you can all see the slides. Okay, can you all see the slides? Can't hear? Hi. Padma, can you hear?
Yeah, we can see them. Yeah.
Okay. Okay, so I'm Professor Asad Nizami. I'm a professor of psychiatry, and I am also chairman of the Institute of Psychiatry, which is a WHO collaborating center for mental health for the Eastern Mediterranean region. So when I talk about Eastern Mediterranean region, this is a region which the WHO has made extending from Pakistan to Egypt, and we're a WHO collaborating center since 1985. So we do a lot of work regarding mental health, policy making, and how we initiate different kind of trainings. So when this COVID pandemic came, I think we've been active since the very first day. And I'm thankful to my other colleagues who have set the stage. Najma explained how people react to when you have this COVID pandemic, and Prathama very beautifully outlined that how you experience different symptoms and what you can do about it. And now I'm going to talk, the time that I have is about what do you have or what happens to some special populations during this COVID pandemic. And therefore, I'm going to talk about the mental health assistance that we can provide to this special population. Now, the picture that you see on the right, on the left side is just about 2 days back. The Institute of Psychiatry is at these days providing facilities to healthcare workers, and you may see a small written down mild ward. So we do have patients who are susceptible of COVID positive infection, and we look after them, and that's the staff that we have. And I always make sure to visit them daily, so to boost them up and motivate them. And below you see our telemedicine center. The world has changed. Previously, we used to sit across, talk, do everything. Now everything is now gone electronic. So I think I won't go to this slide of my introduction. I do a lot of other things, but what is more important for us to understand today is that what is this pandemic doing to us? And very recently, since all the school, colleges, universities were closed, so were the medical schools in Pakistan. And we had a very bright number of medical students who decided to go through a small survey. And this survey has gone through more than 500 plus medical students. And we wanted to find out how they at this time are perceiving, because obviously they become a big line of defense at this time. So surprisingly, about 85.5% of the medical students said that they felt disturbed. And there were those lucky for 14.5% who said they were not disturbed. So this is a raw data which will possibly be able to publish. But the interesting fact was that I had more interest that what were the worries of those 85.5%. And I think two of my panelists have already talked about a few things, but let's look at what they had in mind. So a huge majority had this fear of death and losing a loved one. And that was about their own perspective. And then a majority were worried that they're stuck at home and they have nothing to do while they're staying at home. And then this word of social distancing and lack of communication has become quite fancy. Actually, what we need to understand is that this is not social distancing. This is actually physical distancing. So the word came up with the social media, and till now everybody is following the word of social distancing, which means you're not able to socially interact. It's not like that. It's only about a physical distancing. And then there was a huge number of students who were again very uncertain of future. So like I think Najma was talking and Prathama was talking, in most of the infections, that started and is going to end. Some of the disasters, they start and they end. But here the issue is that everybody is worried that when it is going to end. So every time you sit in front of your television, you find out that, look, the rates are escalating, the number of deaths are escalating, and nothing's happening. And that's what these medical students wanted to know, that is there going to be a vaccine? There's no vaccine. What's going to happen? What is going to be the world after this pandemic? How it's going to affect our economy, about unemployment, domestic violence, and then possible rise in the mental health issues. Because here we must understand that there are two populations when we talk about mental health, because they're ones who are healthy and they are also feeling the burden of this pandemic. But then there's a huge population who already have a mental illness. And the worrying thing is that they have difficulty in accessing to mental health facilities, their anxiety, their depression, their fear, that gets escalated. So both of these populations are getting vulnerable and more vulnerable, and we need to find out what to do about them. Now, this word, this mental health and psychosocial support, is going to become a big buzzword, and every time in the next 6 months or so, you will pick up any document, whether you're looking at somewhere, people are going to talk, oh, when you're talking about mental health, yes, MHPSS is very, very important. So you go to official documents, you find that out. Now, this MHPSS is not a rocket science. What this MHPSS only says is that this is actually any type of local or outside support that aims to protect or promote your psychosocial well-being. And it also is there to prevent or treat the mental disorders. So at this time, when we are looking for, is there a vaccine, is there a medication, the trials going on, what we need to understand that not everything will get treated by a vaccine, not everything will get treated by a drug or a medication. There are always other means, like there are times when we talk to each other and we felt relieved. So this MHPSS, or the mental health and psychosocial support, is a designated word, and this is what it means. Now, what do you do in an MHPSS? It has a number of range of activities. I think some of those activities Najma talked about, Prathama talked about, they're very simpler activities. We know that, but what is happening is that we are so upset, we are so anxious, we are in a panic state that we forget to exercise them. So these range of activities are only there that can improve your well-being. That can be for the individuals, for the community, and the affected environments. Now, what we need to understand is that there are a number of sources from where you get information. Like Prathama said that somebody would say that don't please go over to your WhatsApp group. But these days, not even these days, even prior to that, I think it was very, very common for everybody to spend hours on looking into what's the Instagram is saying, what is coming in the WhatsApp, who has tweeted what is on the Facebook pages. So, you have so many sources of social media. The issue is that there's no harm in looking, but the harm is that this social media may possibly at times provide you with not the correct information. So possibly that's where the WHO guidance comes in, that you need not spend too much time in front of the social media, because that makes you more anxious and more upset. So I think this interagency standing committee are the ones who work with WHO and the other organizations, and they thought that let's design some very simplistic and easy strategies which can be applicable, which is be able to understand by everybody. So they call this as the mental health psychosocial aspects which you have in the COVID-19 pandemic. Now I'm going to cover a few certain populations, and I'm going to talk few things which are very relevant to this section of population. So the first population that we need to talk about, and I'll come just in a while, but try understand that this method or this strategy, which I'm going to show you in the next 2 slides, actually is applicable to every kind of population. Either you talk about children, either you talk about adults, either you talk about older adults or elderly population, or those who are working as healthcare providers. The first thing is that we need to orient the responders, understanding how the pandemic is going to affect them, what are going to be the psychosocial aspects. So what we are doing today is actually giving you this orientation. The second thing is understand the referral pathways, because whenever you have a disaster or a panic, you go into panic yourself and you forget that where you have to look for resources. If you have to look for eatables, if you have to look for health resource, must understand which are your referral pathways. Thirdly, distribute timely factual information. The word is factual information. Please restrain yourself. Whatever comes to you on your social media does not need to be transmitted in next few seconds to everybody. That's not appropriate. Provide MHPSS to people in isolation quarantine. So as I said, that this mental health and psychosocial support is not rocket science. When I go to my other slides, especially focused on certain populations, you'll get to know that these are very simplistic strategies which all of you can utilize. And then it's very, very important, the fifth portion, protect the mental health of all responders. Sometimes it happens that we are actually very, very overwhelmed. When we get to know this thing that this hospital requires us, this facility requires us, we tend to forget that we as healthcare providers in any capacity need to be well. If you are not well, if you cannot maintain your own health or mental health, you will not be any assistance to any kind of hospital setting or any healthcare provider. The next thing is addressing mental health of people who already have a mental health issue. And that's what I said recently, that there is a huge population and they may be within you, among the community. We need to understand what we can do for them. The older adults requires a different kind of help or a strategy, which I'll just talk about. Stigma is catching up very, very quickly. And believe me, now when I talk to my colleagues, when I talk to other healthcare providers, they say that if at any time we do get positive with the COVID or the coronavirus, we are being outlined like anybody. So people do not tend to come closer to them. If a household and people get to know that this household, somebody has been COVID positive and this person though is in isolation quarantine, they would not like to possibly meet. So that's another kind of a stigma which is emerging, which we need to understand that no, those who may have become positive or who have this virus, they need your support. You should not stigmatize them, you should not outline them. Another aspect I think Najma talked about is this opportunity for bereavement. At the moment, we are so preoccupied with our physical needs, our physical health. We're not looking into this aspect, but this is obviously catching up. You cannot go for the burial, you cannot possibly see who has died. I had examples when I was visiting the quarantine and isolation wards that the father who would die from being on a ventilator, the wife and the children are in a separate ward, and at the time of burial they were not allowed to go out because they were themselves in isolation quarantine. There are examples of children who were in US and UK and their father and the parents dying here in the country, and they were totally not possible to see them or to come over. So that's another kind of issue that we are going to deal possibly very soon. And the last bit is about integrating all the responses. So, all of us would want to help, but we must understand that we can help and we should help, but in a manner that our resources are not getting wasted. Our resources are integrating in a manner that it is going to be helpful for the others and not possibly create a barrier for the others. And that we have seen in a number of disasters that have happened in the past. Now, when we talk about special populations, I think when you talk about children, must understand that children are not like us. They cannot express. So their way of expression or their way of communication is going to be very different. Why? Because since they can't express, I'm talking about smaller children, what they would do is that they would have a change in their behaviors. They would like to cling to you. They would like to come closer to you. They do not want to be separated. They don't want to be away. And that's a time which you should understand. If you are yourself irritable and you're yourself getting upset, you may want them to be alone. You may scold them. Please don't do that. I think what you need to do is that you need to look into that what alternative possibilities you can provide to the children. And if there is a time that, God forbids, you yourself get infected and you have to move away from your children, please keep that in mind. And I would possibly, not me suggesting, this is what everybody is suggesting, that you need to make some alternative arrangements. Because at that time, if you do tell the child that, no, I have to go to a hospital, I have to be there, or the children are there and they are in a separate ward, that's very, very anxiety provoking for the children. So when you're at home, try maintain familiar routines as much as possible. These days, the learning and teaching is all online. So try spend and try organize that how your children can possibly do their online teaching, learning, training, but can you create some different activities for them too? Talking about older adults, I think older adults are already the population which do not have a number of formal contacts or a formal network, because majority of the friends, colleagues that they have may not be there in this world at this time. And now they become vulnerable because when they sit in front of the television and they're being told that, look, anybody at the age of 60, 65 is very vulnerable. Most population at this age were vulnerable to this virus, I think they get more upset. So please try and maintain any kind of informal network that they may have. It could be you, it could be anybody, any of the family members that they may have. One of the other important thing is when you share any information with the elderly, please do it in a very simple manner. Why? Because at that age, they may have some kind of cognitive impairment. They'll not understand a lot of statistics. They will not understand what's happening around the world. Yes, they will see, they may not talk, and they will perceive it in a very different manner. So what you need to do is to have a regular contact with them. I think that's what Prathama was saying, that organize your daily routines. If you're able to organize your daily routines and you have got a lot of time, you can sit with them, talk with them, and repeat the information. And again, unfortunately, I'm using the word unfortunately, be prepared. If at any time you know that something goes wrong to them, you should be very clear of where to get help, how to move them to which place, and when to do that. So I'm not saying that you make them upset, but you should be knowing about it. So keep
Dr.
your
Assad,
contact with them. Yes. I know I'm
we're
over time.
coming to the end of time now, so if you could move to your last slide.
Okay, so I think what I'll do is I'll just skip one of this slide, which is about isolation and quarantine. I think that's what Prathama has already said, that maintain your daily routines, exercise, sleep, healthy, food, and you can still stay connected. I think this would be my last slide because that relates to healthcare workers. I've already talked about that. Please look after your own coping strategies. So if you are healthy, you can provide help. Avoid any kind of unhelpful coping strategies. Could be tobacco, alcohol, or anything else. That should not happen. Trust your colleagues, your managers. They can provide you help, and use some understandable ways of sharing your messages. This is just Urdu version of the psychological first aid, which is being designed by the World Health Organization. It's for everybody, yourself, community, patients. We had the Urdu version, the institute translated it. And lastly, I'll just say that yesterday I was clever, so I wanted to change the world. Today I'm wise, so I'm changing myself, and thank you all. This is the helpline that we have from the Institute of Psychiatry. Thank you all.
So thank you, Professor Assad, and thank you to all our panelists, and thank you to our audience who have sent in some most excellent questions. So panelists, if you can ready yourselves for the question and answer session. So I've got a few of the questions that I've been through just here. Now, one of the interesting comments that we've had from one of our one member of the audience is that for the majority of people, COVID is going to be a self-limiting illness, both physically and psychologically. And this has prompted our questioners to ask, how should we promote this and when should we choose to intervene? Question for Dr. Najma in the first instance.
Thanks. I get landed with it. So I think, yeah, it is important to highlight that it is for the majority of people a short time-limited illness, and I think it is perhaps worth including that information. But I think that there's also other things associated with it. One is obviously the higher risk for certain vulnerable groups. And it's really difficult to send out a public health message that ignores that. And then the other things that go along with it, the lockdown, so the physical distancing and so on, and the practical difficulties, particularly when there are really quite serious economic impacts. I think it's very difficult then to sort of separate that out and give this message that this is short and sharp and time limited. So I think it's a difficult message to get across. But I think the questioner is right to say that at least, in terms of reassurance on some fronts, it is possibly worth highlighting that a bit more.
Okay, thank you, Dr. Najma. So, any of our other panelists got any response to that question about the distinction between normal and abnormal and promoting the notion of this being, for the majority of people, a self-limiting illness?
Let me just add to what Najma has said. I think the most important thing to remember also is that even though people may feel momentarily distressed, many people are resilient, and I think it's really how you respond to this. And if you really go by the fact that a majority of people are going to be well, I think it's important to keep that. A lot of countries now are actually saying what percentage of people recovered, and I think that's something that's growing all over the world. But I think at the same time, given all these uncertainties, it is expected that several people will go through these things, and therefore to reach out to informal support systems is very important, but also to recognize that these are times when vulnerable people are likely to get even more disturbed, and therefore to reach out to help is also equally important.
So that's important to think that there will be some populations that are more vulnerable than others. Now I'm going to go on to our second question, and I'll direct our second question to Dr. Assad. So lots of questions have asked about the role of the media. The media can be a source of useful information, but can also be a source of anxiety and can fuel people's anxiety and can sometimes give misinformation. So Dr. Assad, do you have any thoughts on how we could stop the media fueling panic and anxiety in the population?
Okay, thank you. I think one of the aspects which we need to understand is that you can't stop the media. So, the media houses are big business houses. So that's the time when they would possibly cash on a lot of things. Now, the question is what we can do, because we have this opportunity in our hand that if you want to know, yes, nobody stops you from reading the newspaper or looking into the media. But the WHO guidance comes is, and they very clearly write down that limit the time that you're spending with the media. So the answer is that if at all you want to know that what's happening around the world, you can spend something like 45 minutes in a day's time looking into different areas of media and getting informed. I'm not saying do not get informed, but if we go over to the media, yes, I find media is playing a role in different ways. There are a number of channels which may be propagating a very positive aspect. Like the previous question, they would highlight that yes, a number of people are getting well, and they're being realistic that no, take precautions. But then there are a number of media which would say, oh, there are no respirators, there's no N95 mask, there's nothing happening, people are dying, there's no place to go. So I think that creates a chaos and anxiety. So what is being advised is that you have got some very pertinent sources of information. And the WHO is very clearly advocating again and again that you can go to the WHO website, you can go to your country's local health authority website, look into it, what is happening, and feel comfortable and trust the governments. So you don't have to go over to all kinds of media. I think you will not be able to stop them, but you make a choice of your own.
So, Professor Pratima, how could we use the media for good? How can we promote good mental health by engaging with the media?
Yeah, so I think the word is engagement with the media. I think a lot of credible people need to engage with the media. I think we also need to teach people, I know in life skills, one of the things is critical thinking. So I think it's important to really be able to evaluate any bit of information that you get. And I think by contributing to articles, whether it's in social media, whether it's a thing, one of the things that I do is actually, engage with reporters who come up with who call with a lot of these kind of sensational, bits of news. And then you kind of, you bridge that news and actually give them the fact or the neutralizing information. And I think that's very important because I think media can be a very, very good source to spread the right kind of information. I think we need to support that as well.
And what about the University of WhatsApp?
I refer to that, and I mean that's constantly, on the boil, as it were. So I think, of course, that the only way you can actually do that is by posting credible information, even on WhatsApp. And I think organizations like the WHO need to turn to social media as well to project the right kind of information.
Excellent, thank you. Any comments in relation to the media from Dr. Najma?
No, I think it's all been said.
Good, okay. So my next question is also about the media, and Professor Assad mentioned this a little. Many of the questioners seem to have encountered people who spend a disproportionate amount of time checking news and checking media sources, and this is starting to feel in some way pathological. So how might we help the people that we encounter who spend a disproportionate amount of time checking the media in a psychologically unhelpful way? Question to Dr. Najma.
Okay, so I think this is also partly a technique that we encourage people to use in order to manage worry. And I'm putting media and worry in the same bracket here because a lot of the news is going to be sensationalist. Yeah, at the same time, you do really want to, I said in my presentation that having information actually was helpful. So, it helps maintain a sense of control. So I would say that try and identify a couple of sources of information that you trust. So that's the first thing. So, in the past, these are the sources that you think give you a balanced view of what's going on. And then stick to them. And also stick to a time window. So you set yourself up either once a day or perhaps twice a day at the beginning or end, or whatever suits you, a window where you're going to check. And it'll take some discipline, it'll take some practice to do this, but really try and limit it just to those what I would call worry sessions, where you allow yourself to go and have a look at the news, see what's going on. And I think that's a way of parceling out. So during the rest of the day, when you're doing other stuff and this worry pops into your head, oh, I wonder what's happening, I wonder what's going on. It's part of that that worry cycle. You can say, oh, I'm going to check at whatever 6 o'clock, or that's when I'm going to do that. If I break off and do it now, it's going to make me more anxious throughout the day. So I think that's my top tip.
Excellent answer. Okay. Now, a couple of the questions have been about particular vulnerable populations, and one of the vulnerable populations that's been highlighted has been older people, and Professor Nizami picked up on this and he briefly touched on this. So I wanted to invite Professor Murty and Dr. Najma to perhaps talk about vulnerable populations, in particular older people. So what are the challenges for older people in preserving their mental health?
speaking, as far as older people are concerned, I think there's already a sense of, older people feeling neglected and isolated, especially when their partner dies and they're alone. And especially when older people read media news, that, for example, people above the age of 70, 60, 80 are not given care. I think that can be particularly traumatic to the elderly. So the isolation increases. The second thing is that, of course, we know that they're vulnerable because they have comorbidities, their outcome, if they do develop a COVID infection, are things. So I think balancing this concern for them in terms of not getting the infection, but at the same time, giving them adequate attention is very important. I know during lockdown that a lot of them who were getting help to help them at home, though that help was not available. So making sure that either their family or indeed other things in society offer them that kind of help, helping them to use the internet and other technology to keep connected with family, maybe spend virtual time with grandchildren, making sure their nutrition is adequate, they have adequate exposure to sunlight, to vitamin D. I think these become very, very important in addition to their emotional health as well.
Thank you very much, Professor Pratima. So, Dr. Najma, any final comments for you in relation to how we might help our older population stay well?
I think it's also perhaps just worth recognizing that they're going to have some additional worries, aren't they? Because they have been classed as that vulnerable group, and there are also a prospect that lockdown might be extended for them, and just acknowledging that and recognizing that. And I think all the things that Pratima mentioned, I think they're all different techniques to help. And absolutely, the internet has been a godsend. If people aren't used to it, I think this is a good opportunity for them to start using it. And I've seen that, just in my own networks, that has increased, and that's a way of increasing people's autonomy and sort of and feeling of empowerment. So I think I'd really push that.
Okay, so we're coming to the end of our session just now. So I'm going to use Chair's prerogative to ask my question. So one of the things that has emerged from the early experience of COVID, particularly in China, is that people who smoke seem to be at the greatest risk of developing physical complications and even dying of COVID. So smoking is the single most important modifiable risk factor if someone wanted to make a positive step to improve both their physical and their mental health. So Professor Pratima, have you got any thoughts and reflections about how we might help people to quit smoking just at this time?
Yeah, I think, Simon, just continuing where you left off, I think there's enough evidence to say that people who smoke, for example, do a lot of touching of their fingers to their mouth and their lips, and therefore are more susceptible to COVID infection because they already have compromised lungs. Their outcomes from such infections may be reduced. Their reduced immunity also makes their outcome more. So actually, this is and lockdown, of course, has reduced the access in many countries to tobacco products. So what we're trying to do is convert this challenge into an opportunity for people to quit smoking. And in our tobacco quit line, which we have for Southern India, we've actually had more people calling and reporting more frequent quit rates. So I think that's been very helpful. But also at the same time, we recognize that people who are heavily dependent on tobacco, on nicotine, need help. So I think it's also very important to reach out to smokers, to support them in their quit attempt, to encourage them to quit, and to provide the opportunities to quit in a reasonable manner.
Excellent. Thank you very much, Professor Pratima. Professor Assad, have you got any final thoughts before we wind up today's webinar?
I just related to the smoking aspect. People are asking that how can media play a good role? I think this is one opportunity where it can be publicized through media that smoking does become a risk factor. It can make people more vulnerable because from research, we know that in any disasters, the intake of tobacco, alcohol, benzodiazepines, they definitely go up, especially when people are at home and locked down. So I think what my last words would be that we've talked about a number of aspects. I think there are very simple guidance available. And I think what we need to understand is that keep hope. So we should not only think that this is not going to happen, when it is going to happen. I think what we need to do is about here and now. So what we need to concentrate is that what is happening now, what we're supposed to do now. Yes, our lifestyles have changed, but if we keep a regular routine that we are continuing with our work and with our family, I think that's what we should utilize this opportunity at this time.
Excellent. Those are fantastic concluding comments. So thank you, Dr. Assad. So as we get to the end of our webinar, I want to particularly thank our most excellent panelists. So thank you to Dr. Najma, thank you to Professor Assad, and thank you to Professor Pratima. And I would also like to thank Anna and Nikki, who have been working very hard behind the scenes to make this webinar run very smoothly, and they have succeeded in their task. So thank you to our team helping us to organise this today. My final comments are that the slides from today's webinar will be made available, and we will email a link to the participants where you will be able to access these slides. And if you have additional questions that you would like us to address in future webinars, then please get in touch with the team, and we will seek to address questions and give further presentations as the question of COVID and mental health evolves. So thank you very much, everyone, for your attention today and for your excellent participation and questions. So it's goodbye from myself, and thank you and goodbye from our panelists.
Thank you.
Okay, thank you. Have a nice day.
Bye.